When it comes to aging, many people will chalk confusion up to the aging process, but it's not always the cause. In normal aging, the brain does shrink in size. As people get older, they will experience, for example, a decrease in the speed of processing, or how fast you do things and how fast you process information. Attention can be affected, especially when there are multiple things going on at once. Mental flexibility and abstract thinking also change. You may forget a name or where you put your keys. Generally, changes are subtle and deteriorate over time. Confusion, beyond that, caused by normal aging changes, needs to be examined. It can occur in older adults of any age, with early onset dementia occurring in people even in their 50s. Some causes of confusion can be more serious and reflect severe underlying medical issues in the older adult.
So confusion is, probably the bread and butter of a lot of what I see. But, very quickly we have to figure out, am I looking at confusion that's been there for months or years? And I'm just trying to clarify sort of what is the cause of that? Or am I looking at that confusion that came on very suddenly and I'm looking for, another medical cause?
There's definitely different reasons why one might be confused. Certainly, those causes can be both physical in nature, it could be changes to their environment or their home situation. So it's really important that when somebody is presenting with some confusion, really trying to understand what might be the cause of that. So taking it back to looking at what has changed.
Within the NSM SGS program, with Waypoint as its lead agency, when we assess confusion, we look for a variety of possible causes like delirium, dementia, mental health conditions, substance use, and medical conditions. Delirium is a medical emergency and requires medical attention. 50% of older adults in hospital have had an episode. In delirium, you can see a sudden increase in confusion, and the confusion may come and go throughout the day. The older adult can sometimes become agitated, and sometimes there can be hallucinations or seeing things that aren't there. It can occur with things like chest or bladder infections, a change in medication, anesthetic, and pain.
We don't know exactly what causes delirium, but what we do know is that when the body is really stressed, in particular from a medical illness, that a bunch of hormones and chemicals and things that are released in the body as part of that stress response, and it seems to break down the pathways in the brain that let the different areas of the brain talk to one another. And so all of a sudden the brain's not working properly. There's really two factors that can influence it. One is how vulnerable somebody's brain is, and obviously as you get older and you've had a lifetime of things that could happen to the brain and hardening of the arteries and other things that can sort of make the brain not function as well, then it can be a little bit more vulnerable.
When the cause of delirium is resolved, the confusion usually improves, but in some cases, it can take time, and in some other cases, things never return to the way they were before. A second cause of confusion is dementia. Dementia is an umbrella term, meaning that there are a variety of diseases that fall under that term. The most familiar one is Alzheimer's disease, but there are other types like Lewy body dementia, vascular dementia, and frontal lobe dementia. But whenever we look at all the causes of confusion, we must also consider medical conditions, mental health conditions, and substance use too.
I mean, dementia is the most common reason for confusion that happens sort of, just slowly and over time. But anything that causes the brain to degrade can cause the same kind of thing. So, Parkinson's disease, and there's several variants of that can cause it. There's a series of dementias that are called frontal temporal dementia that can cause it. Alzheimer's disease, of course, would be one of the most common things. But then there's a whole bunch of other things that can mimic dementia that we need to sort of rule out. There's, some infections, like, variants of mad cow disease and things like that that can cause it. People that have sleep apnea.
Some people, when you're faced with a high stress situation, you might turn to different coping strategies that perhaps aren't as helpful to your overall health and wellness. So sometimes we looked at self-medicating with over-the-counter medication or prescription drugs or alcohol. And in many cases for the older adult, those types of medications, for lack of a better word, can actually lead to increased confusion.
Confusion in the older adult can cause stress on the individual themselves, on the caregiver, and family and friends. There are a variety of ways to engage with someone who is confused. For healthcare professionals, it's all about communication.
So I think it's really important to kind of provide some reassurance, right? Really kind of identifying yourself, introducing yourself as somebody that might be a safe person that they can talk to, really trying to understand what's going on. So having some conversation, exploring what they're feeling, what's happening, just trying to get some information, because once we have a bit more context, we can certainly kind of respond, right? So really that reassuring, calm voice, very soft approach.
Can confusion be prevented? The Alzheimer's Society of Simcoe County says regular routine and healthy lifestyle is key.
So we look at staying physically active. We know what's good for our body is good for our brain. So when we exercise, we're increasing blood flow, and we want to do that for the cells in our brain to keep them nourished and healthy. So getting daily exercise is a good strategy. Eating well is also important, that we consider what we're putting into our body to feed ourselves is also feeding our brain and feeding our brain cells. So getting foods that are rich in antioxidants.
Staying cognitively active is another way to keep your brain strong. Puzzles and other games stimulate your brain and can keep you as healthy as possible. For older adults who are experiencing confusion, or for family and friends who are seeing confusion, make sure you have a conversation with a member of your health team. This could be your doctor, nurse, pharmacist, or physiotherapist. For all older adults, the NSM SGS program encourages you to keep your brain active and healthy for life.